Good afternoon. Right, we're back on here. Welcome to the first plenary before or after you break from lunch. I'm James Chow, UNA's Goodwill Ambassador, and delighted here to be today with you in this space to talk about public-private partnerships. Of course, the global response against AIDS as we know it is now 33 years old after being first confirmed in 1981, June 1981, in New York and San Francisco. And of course, as we all know here, since that time, the face of AIDS has changed dramatically, and thankfully, so has a lot of that response, though of course, that gap to fully respond to it is what we're here still working on in 2014. As part of that gap, we're trying to introduce and implement more the PPPs, the public-private partnerships. And it was only 2 years ago in Washington, D.C., where I think we saw the first PPP session. That was only one. And we're so happy that we can be hoisted into plenary, as well as many, many subsidiary sessions yesterday, today, and through to the end of this week. The PPPs have been designed to leverage the different, but also the complementary strengths of unique partners for both the private and also the public sectors in a wide range of HIV care, treatment, and prevention programs. And this formal partnership really has the critical opportunity to reconfigure parts of the international health landscape, the infrastructure, enabling sustainable interventions to be deployed at scale. And we're going to talk about what kind of scales we're dealing with in different communities. Now, to understand the factors behind successful, sustainable PPP models, this session today, for the next 60 minutes, we're going to review the motivations, the policies, the practices of the private for-profit firms engaged in PPPs and what drives them to commit PPPs over the long-term future. The panel will explore future trends for all these partnerships and examine successful, innovative pilot interventions now being scaled up to improve equitable and sustainable access to and provision of HIV and AIDS services. So let's start to your far left. We are joined there by Peter Botten. Peter Botten is a friend of our AIDS family for many years. Oil Search is whom he works for as the managing director based over in Papua New Guinea. Sitting next to him is Dr. Christoph Ben, an epidemiologist and now the director of external relations at the Global Fund based over in Geneva. And we're delighted to have with us also joining us from its headquarters in California, Rhonda Zygogi. She's Executive Vice President of Policy and Planning for Chevron Corporation. And Rhonda, why don't we start off with you? And welcome to Melbourne. Just arrived. When we talk about public-private partnerships, these three words in conjunction, what comes to your mind first?
Well, what comes to my mind first when you talk about PPPs is, in our business, probably trying to solve a social issue that's impacting the business. A public policy issue, something you cannot solve alone and takes you outside of your fence line. And AIDS is a great example of that. You know, we've been in this fight for 30 years, starting back to our roots in San Francisco. Fear was gripping, the city back then, the mid-'80s. We couldn't solve that alone. We got involved with other businesses to create education. As we saw this impacting our workforce, we had to pull in others to develop policies for support and treatment of employees globally. And then, even if you can make your workforce healthy, something like AIDS sits outside your fence line. And when you have an issue where your workforce productivity is at risk, your supply chains are at risk, and your communities that are your neighbors are at risk, you cannot isolate yourself from that. You have to take action. And when you look at an issue like AIDS, you cannot solve that alone. So it needs scale, it needs multiple and complementary skills, it needs a lot of resources, and it needs a long-term commitment. And I think the PPP framework is very well suited to address something like that. So getting back, it's when you're hit with a social issue that impacts your business that you cannot solve alone, that needs scale, needs different skills, the PPP framework works. That drove us to the Global Fund in 2008 as one of our biggest PPP kind of frameworks for this issue.
Well, let's talk to the Global Fund, to Dr. Christoph Ben, who's been in this role for quite a number of years now. And you've seen dramatic changes, not only in HIV and AIDS, but also in public health as a whole. You partner with so many companies, of course, perhaps most well known with Product Red, Nike, Apple, so on and so forth, and of course Chevron and Oil Search. How do you look at PPPs today. For you, it's nothing new. For a lot of the world, it still is.
That's right, and I'm still sometimes amazed that this fantastic idea, now is really materializing, because it was anything but self-evident that these very different partners would come together. It's not that long ago that thinking of bringing the public sector, the governments, the civil society, and the private sector together on a common cause was quite challenging. But it is working extremely well, I would say. And to bring out the best out of these different sectors, the private sector has so much to offer, and not just in terms of their financial resources, but in particular in terms of their innovation, their skills, their technology. And we need that if we want to achieve our kind of global goals. We want to end this epidemic. And we will only be able to do that if we really bring all those partners together. And I think we have now, anytime we meet at an AIDS conference and so on, we have more and more excellent examples of that. And that's the beauty of where I see this public-private partnership standing now.
Bringing them together, political leadership, I know that Mark Dybul works heavily with heads of state, with civil society, with private sector leaders. But Peter Botten, Managing Director of Oil Search, how important is it for a company's response to HIV and AIDS to be coming from the top, for there to be a key figure like you, like Rhonda, rather than an add-on, rather than a CSR add-on on the side?
Well, I think it's absolute key to success to drive an ethos through a business to actually prioritise this sort of arrangement and partnership throughout the organisation. And if you don't have that leadership and can't see it through the organisation, I'm sure that the impacts will be significantly diluted. One of the greatest things that I see in our workforce is that from the very lowest level, people working on the ground in the village, they understand the vision, the process and the systems that we are applying to help not just Oil Search, but also the country and the communities in which we are intimately associated. Without that leadership, it just doesn't work. This is just not a CSR issue. This is not just a tick in a box. This is, and going to fill a sustainability report, this is actually about people that you work with, your colleagues in your organisation, and the people on the ground who are dying from a disease that can be treated. And when that message is there, you get empowerment and delivery.
Well, as Michel, sorry for cutting you off there, but as Michel Sidibé said in his GAP report just a couple of days ago, we can no longer look at AIDS as one simple epidemic. There are many complexities that lie within, and therefore we need to focus on location, also in population, on quality of treatment as well. Peter, for you, I think it's been more of a stark choice. Oil Search contributes anywhere between the high teens and the low 20s in terms of percentage to the entire GDP of an entire country, which is Papua New Guinea. And therefore, you really had to make that choice as to whether to keep your workforce healthy or not. But Rhonda, I want to push you a little bit on this point here. You said that it was a simple choice for you, that it was about going beyond your fence lines, you said. That's a beautiful way of putting it as well. Going beyond your fence lines and keeping your workforce family safe and healthy and getting the best out of them and recognizing that. But in the 1980s, even political leaderships were making different choices. They were not talking about HIV/AIDS in public at all, probably not even in private, whereas to this day, people continue to discriminate in the workplace. They just fire or just ignore or do not promote. For you, clearly, it was a very, very different decision. What made you and Chevron think beyond those fence lines?
Well, first of all, what made us think was what's happening inside the fence line. Like Peter said, we operate where the grip of AIDS is the strongest, sub-Saharan Africa. And when you watch employees fall ill, when you watch loved ones die, we have 13 quilts at Chevron headquarters in memory of lost colleagues, loved ones, children to this disease. You don't stand back. So your first responsibility, as Peter says, is as an employer, is to your workforce. And it is not CR. For us, it's a global policy to support, educate, provide access to treatment to every employee and their family members. Now, you get your employees healthy, but that fence line you're into your communities, your supply chain. How can the nations where you're doing business for not just 10 years, but 80, 100 years? You're in these countries for a long, long time. You have a long-term business. You have to take a long-term interest in the welfare of the business services you are going to access. And so that's how you get outside your fence line, because your presence there is very long-term. You can't just make your workforce healthy. You have to look into, is this country going to supply the supply chain? Is it going to have the capability and employability? And health is a part of that.
Was there any fallout from being so closely and publicly associated with an epidemic that, at that time particularly, so many people found so abhorrent, so disgusting? Was there any fallback for your employees, for your branding, that you can remember?
Not that I can remember. Let me just clarify that we got involved back in the 80s, about 30 years ago in San Francisco, where just the fear of this disease was going through the workplace, and we did a lot of work to just communicate and distill kind of misconceptions about the disease, because that was impacting us. But it wasn't until 2005 that we put into place our global policy, and not until 2008 that we moved outside the fence line in a big way with the Global Fund. So, it's only been 8 years since we reached out, and you reached out in a partnership that was globally kind of put together and accepted as the body that was going to tackle this on behalf of governance around the world.
I know many companies, especially where I live, who don't even want to be involved in HIV/AIDS, let alone on a scale that you're talking about and addressing daily. Peter, I wonder if you could share with us some examples with our audience as to what PPP means to you in terms of the printers that we talked about, the paper, the locked doors, the non-paid bills. Explain to us how simple a PPP partnership can make enormous change as you work with the Health Ministry in Papua New Guinea at national level.
Well, obviously our partnership is primarily with the National Department of Health, but also that extrapolates out into the provincial governments where they are dramatically overburdened by challenges of all sorts of service deliveries. We have to play a role to help the government deliver those services into not just the main cities, but primarily out into the village and rural communities, which frankly see almost no services at all. And from that perspective, it is frustrating to see the major arms of government who have some very dedicated people working for them, but you can't work if the electricity is off and the phones don't work. And the reality is, dealing in Papua New Guinea, it is our backyard, and having a very large footprint in some of the most rural, remote areas, challenging areas to operate, we have to step up, we have to help government, not just at the national level, but provincial level as well, to deliver these core services. And going one step further than that, this is about people and saving lives, but from a corporate perspective, look after your employees. 85% of our employees come from the local communities. If we don't get that right, that's a problem. But more importantly in the future, if we don't help government deliver services, then our operating environment will deteriorate enormously, and our ability to actually do our business, produce oil and gas, will go out the window, and we won't have a business. So a compelling business model, but with an absolute overlay of social and employee welfare in the mix.
Obviously, identifying that intersection between corporate interests and public health needs is critical to achieving a program that is realistic, that is sustainable. For any potential champions in our audience today, or who may be watching us online, what would you tell them are the plus points? Why is it a smart business decision to take care of your employee family? It may seem obvious to you, but it may not be obvious to them at all.
Well, it's in productivity. You're investing in their training. It's getting the most out of that. You want them to have a long career with your company. You don't want illness to be impacting productivity. You don't want the health costs of your company to be more than they should be. And so I think that business productivity is the intersection, is the business intersection as an employer. And if all employers globally took that role, that's taking care of a big portion of today's society. You know, a nice example, you talk about the intersection of government and employee productivity. In Nigeria, NACA, we got a partnership with NACA through the Global Fund, but one of their goals was to get education down to the small businesses in Nigeria. So one thing we had is from our employees is what we call peer educators, employees who are trained in understanding this, and then they would go out into the communities and serve NACA's goal of getting small businesses educated, and then those employers can take up the cause. And so it's a way how public-private partnerships work. I mean, we're not in the health business, but we can be in the supplier engagement business or the logistics business and things that we can offer into these partnerships. So there's a way, and we have found that being introduced to the issue, understanding how powerful just education is, you get some small businesses coming on board with their own programs.
I don't know if you can catch it on the camera, but each time I ask Rhonda a question, there's a little smile that comes at the start.
Well, I'm so proud of what we do. So.
And rightly so. And I want other people to be proud about this and say that they want to join in what you and Peter are rolling out every day. Do you, apart from just productivity, because people are individuals as well, do you get happier staff as well?
I think a healthy staff is a happy staff. When we can talk about 9 years in Angola and 13 years in Nigeria of employees that have taken the opportunity to use our support for eliminating mother-child transmission of HIV, and we can say over those years we've had no report of an HIV-positive baby for all the employees that participate in that program.
And you have 60,000 plus staff worldwide, so we're talking about...
We're talking about in Angola and
numbers.
Nigeria,
yeah.
But we're still talking to thousands of employees of who participate in the program. You know, that's got to bring a smile to anybody's face.
Yeah, I should also say, I think one other dynamic is if you're seen to be doing this and seen to be doing it well, you actually attract people to that and like-minded people to your organisation. It is actually a selling point to bring great people into your organisation. They see what you're doing and they empathise with that sensitivity and I suppose that family approach. So in reality, it is a branding exercise if you like it that way, but you do attract great people, like-minded people into your organisation by doing this sort of thing. And
they say, I want to be a part of that.
Absolutely. And if you're talking about our Papua New Guinean workforce, certainly it's seen to be iconic in terms of delivering something for the community and the country. And if you're talking about our expatriate or non-citizen workforce, they want to be part of something that makes a difference. And that makes an incredible relationship between you and your staff and helps drive the leadership that you touched on earlier right through the organisation. People join us because they want to be involved in this sort of activity.
Christoph, I asked you to kindly sit in the middle because literally you are the bridge for these partnerships and you have this incredible overview as a person. You're a father of 3 children, I think 2 girls and a boy.
Yeah.
Yes.
Right.
And you're officially Geneva-based, but like many people here in this room, you travel so much. You are responsible for building good and effective and strategic relationships with governments and also with your corporate partners and potential partners. And also you have the science and the technical content to link that together with. Give us an overview, a quick snapshot of what you can offer and what you do offer.
Yeah, I mean, let me first maybe add one example also here, because we've been discussing, you know, the corporate interest, and we've said, you know, sustainable PPPs, you know, need to make business sense, and that's true. But it also requires a lot of vision and personal commitment. And I think Rhonda and Peter are actually good examples for that, because without that, often you don't get a company really involved. And we are trying indeed to kind of build a lot of those bridges, you know, build new partnerships. And I want to mention one example more here from the region, because we've just entered into a new partnership with a business person and his company in Indonesia, which is Dr. Tahir, a very well-known businessman in Indonesia. And we were introduced to him last year, and I actually wanted him to be here for this panel. It would have been lovely to hear from him directly. He couldn't come, so I have to tell his story in a way, because it's also a very personal story. It shows, it often starts with a personal commitment. So here's somebody who, had the dream already. He told me as a kind of young person, he wanted to study medicine and go into health and do something for the health of his people, and it didn't work out for a number of reasons. And instead, he grew a very, very modest family business now into a multi-billion-dollar conglomerate in Indonesia. And now he's at the point where he says, I want to give back to my society, and I want to do something about the health of my people, and I want to partner with you as the Global Fund. So he made an incredible kind of personal gift to the Global Fund last year of $65 million. But not only that, he said, we want to create what is now called an Indonesia Health Fund. I will bring in more business people. I will bring in my friends. We'll all invest in that. And then we can do something sustainable for the health of Indonesia. And partly that goes through the Global Fund because it offers a model, if you like, where we can make sure that the money goes to certain programs. And I actually visited some of those programs with him together. We went to a hospital and looked at what is happening there. He was particularly interested in tuberculosis, and we looked at how can we improve these services and so on, because it's always more than money. You want to be innovative, you want to improve the services. And now we are creating this Indonesia Health Fund together, and I think that's very exciting. And if we get more and more of that going, I think it's really a little bit like a movement, and we're already in discussion in Vietnam with similar business people and in other countries, in South Africa, by the way. And I think that's the kind of beauty of these public-private partnerships, but it has a lot to do also with the personal vision. You need to have somebody who has this concern, who has this drive, and we can then hope to channel that, so that it leads to effective health services on the ground.
You mentioned that wonderful example, individual example in Indonesia, $65 million, and then Vietnam and potentially in the future South Africa. Are there reasons behind that? Is it really just a personal connection, or did you target particularly emerging economies where you could have local champions, and also because the face of the epidemic and where it is today?
It's not so much that we target, but we found that business leaders who come from these countries, who've been growing up in these countries, they know the impact of the diseases personally. Often there's a family story, they have relatives, they have friends who've been affected by AIDS or by tuberculosis or malaria. And then it's only a small step sometimes to say, okay, and now let's partner and let's see what we can do together. That's why I was mentioning these examples. Obviously, we are open to kind of partnerships all across the world, and we have 2 examples here of a company based in the US or in Australia. But there is something about these countries where, business people might be more personally affected and then interested to do something.
There's obviously another benefit, advantage of connecting through business leaders rather than through the public sector, because the decisions can be made a lot quicker. You don't need to go to the legislature to get it passed. You can make the decision based on your board and at your C-levels, or if it's a family company at the very head, like the example in Indonesia. Do you think that's also another advantage in terms of having local champions, to have an Australian company like Allsearch, but very, very much PNG rooted, Peter? Do you think that you bring something different because you are locally based, because it affects all of the majority of your work so intrinsically?
Yeah, we are a Papua New Guinea company, so we focus very much there, albeit we're listed on the Australian Stock Exchange. But it is, for us, very much something that we, as PNG's biggest company, need to work with government and give something back to the country. We have to do that. Our partnership is somewhat different to others. I mean, we are involved through our Health Foundation in delivery of primary health care because, frankly, the arms and legs of the provincial government are not functional enough to deliver that. So we had to get involved in primary care delivery, and our HIV AIDS malaria programs supported by Global Fund are out in the field and in the villages supporting in excess of 60 clinics today. We have to be involved in that. I stress, though, that we work very closely with the government. We work under their strategies. We recognise that we work in a resources business that may not and does not have an infinite life. So part of our process is to endeavour to build capacity in government such that they can take over progressively. But you can't just stand back and watch as a taxpayer in the country and say, I've done my bit. If there are people dying outside your operations, for something that can be treated. So working with government, partnering with government, and most importantly, having good relations with government. So you're balancing up what you're doing with what the government wants is an absolutely important part, and we've learnt a lot about maintaining those relationships. So it is a true partnership rather than just a big company trying to do stuff.
I'm going to return to your relationship with the government in Papua New Guinea. We're not going to let you get off that lightly later.
Shame.
But Rhonda, the difference with Chevron is that it has, Peter's committed so deeply on the national level in Papua New Guinea. Chevron is present as a business, I think, in more than 120 countries and counting. But your health programs potentially impact far more. Have you been able to persuade, as a global business leader, have you been able to persuade other private sector leaders, people that you know through work, but people that you have dinner with, people that you see regularly, especially in the Bay Area, have you been able to persuade them and say, come on board, do what we do, and we can help you, we can provide you with the building block tools that we used and refined and adjusted over decades?
Well, for many years, we and many other companies belong to the Global Business Coalition on Health. And that was a forum brought to life by Richard Holbrooke many years ago, exactly for this purpose, to get companies involved in taking care of their workforce to fight HIV/AIDS. And so I think there's lots of growth from that coalition over the last 10 years. And so there's a number of companies that have continued on. Anglo-American, Brian Brink is here, one of them. So there have been champions within that global community that started many years ago, fighting this as a workplace issue quite successfully. We find, once you're into this space, you find those centers of gravity. We've just joined a few years ago another business leadership coalition, particularly working in Nigeria, in Nasarawa State, with the government on board to build capacity, to find a pilot model that can be scaled up. And we've just gone through that in the last 2 years. We have doubled the number of health facilities that people have access to, women have access to. This is directed at eliminating mother-child transmission of HIV. And once you get a pilot that works, you can bring others on then to say, this is how it works, this is what we can do, we have the government on board, and this is how much money it's going to take. Will you join us? And so I think it's very important to have, when you get outside your fence line, it's important to be able to show that we have a business model that can work, that government are engaged, and how you can get involved. And therefore, what business looks for is results, that we can put, good resources after solving a problem that's going to have sustainability and scalability. And so that's what we look for. And when you're in the space, you can find those partners that will come in and do that. But as Peter says, alignment to national goals is important. We are more in the capacity building to find the successful models and help government that they can eventually turn into sustainable kind of health systems. And I think that's clearly a place, a sweet spot for business in this fight, helping to build capacity at the local community level, working in the state's government. So in Nigeria, we are very present in the Niger Delta. That's our work front. That's the part of the country that we support. That's where our operations are. And so we look for serving the needs in fighting HIV in that region of the country.
Christoph, the Indonesian Health Minister, Ibu Nasiam-Boy, was, when we talked to her about what we discussed yesterday in having Indonesian private sector champions, she says, I want to be at the session and I want to participate. And unfortunately, she wrote earlier, a few hours ago, she's actually about one room across, speaking right now. So she sends her apologies to everybody. I think she also wants to learn how to progress the idea further so that we have many Mr. Chais, not just one. In China, for example, because I can speak to that example, working as an activist there, it's been incredible in some ways seeing the government roll out programs at will when it chooses to. We've seen that with harm reduction programs, particularly with methadone treatment. And then sometimes we have a gap where it comes to looking at HIV in terms of numbers, and we forget that it's to do with people, families, and communities and populations. It's been very difficult as well in identifying, and once we identified, to get private sector leaders to commit. Now, this is the world's second biggest economy and a source of incredible private wealth. Yet even at organizations like UNAIDS, like Global Fund, I'm sure there are similar stories. It's been very hard to find people to step up to the plate and to say that I want to be a Chevron, I want to be an All Search. Tell us a bit about that.
Yeah. No, you're right. And, I wish we could already report about some breakthroughs in China or some other countries. And
I would do it if I had $1 billion.
And I know, we would celebrate together probably if we had that. And hopefully we'll get to that. Maybe when we meet again in 2 years, we can report about one successful partnership there. But one way that I found has been helpful for some corporations who haven't been involved as much as Chevron or All Search, for example, is to present them with one concrete problem. To say, we have a particular challenge. You have technology, you have the knowledge. Can you help us with that? And we might try that in China or in India or in other countries. Let me give you one concrete example for that where it has worked very well. We've been faced, for several years at the Global Fund with a kind of challenge of procurement and supply chain management. I mean, you all know what we're talking about. It's often not enough to provide the money or to purchase the drugs and so on. You have to bring it to the last clinic, to the last village, and it's particularly difficult in PNG, as I know, but in many countries that's the challenge. We call that the last mile project. And we presented that to Coca-Cola and said, well, you are the expert, you're the global expert probably in doing exactly that. How do you get your bottles to the last village, and can you help us, get the drugs and the bed nets to the last village? And so we started that partnership a couple of years ago, and it has been quite successful, first in one country, that was Tanzania. And again, not that they do it, but like yourselves, they're working with the national authorities and with the government to kind of share their knowledge, their innovation, their technology with them so that they can do that better. Now, we recently announced a couple of weeks ago that we would roll that out in 10 countries. So it needs to be scalable to really have an impact. And if we could, approach companies, maybe in China or elsewhere, with similar, let us challenge them with something. And that might be more successful than asking them directly for money or, what can you do in a general sense. You need to get where they are very strong and where they are proud of what they can contribute, and we'll try to do that.
Well, we'd love it if all three of you came together one day to China, perhaps. When you mentioned Coca-Cola, it reminds me of a friend to many of us here at this conference, Dr. Yop Langer, and he had that wonderful line, and he passed away in MH17, and he had that wonderful line saying that, and I'm paraphrasing here, if we are able to spread Coca-Cola to every part of the world, then therefore we can do the same with antiretrovirals as well. And it does show that the end of AIDS, as Michelle talks about it, by 2030, it really is an achievable vision. It's not just a dream. You talk also about private sectors being able to provide more than just funding. That's to do with ideas. It's to do with innovation. If they're able to build themselves into these fantastic brand names, if they've been able to spread every can of their product, of their soda, to every part of the world, why can't we do that? What can you teach us?
I mean, as you mentioned, Jupp Lange, and we all think of him a lot here. He's been one of the heroes of the movement, if you like, and I knew him quite well. And many remember him as a former president of the AIDS Society and a scientist. But he was also very much involved in an organization that they helped to create that is called Farm Access. And not too many people know about that. And we had been in discussion with Joop and his team on programs in Kenya in that case, where we involved the telecommunications sector. How can we leverage the kind of enormous innovation, but also reach that telecommunication companies now, local ones. We're talking about kind of, African-based companies. So that was one of the ideas that we had discussed with Joop and his colleagues, and we will continue in that also, kind of in commemorating his huge contribution.
And he was also able to, and he rather did what you were able to do, he was able to connect science to the political leadership and to the people leadership
Yeah.
at the same time, and setting up health insurance schemes across the African continent, and in some ways helping to prop up, or in some ways be the architect of entire health systems in the most affected communities. Let me quickly return to you, Peter. Obviously, Oil Search is incredibly unique, because I'm going to brag a little bit on your behalf, and then don't get too comfortable, because I'm going to push it back to you a little bit.
Good.
Oil Search has brought on health ministry staff to work together with your staff. So you've taken the lead from them, but you're supporting them in what their policy planning and in terms of executing. This department has now become the biggest department in your entire company, I believe.
The Health Foundation department
Health
is the biggest
Foundation,
single department.
of
yes.
an enormous company as it is. That is your commitment. There's always a concern about sustainability. One day, if Oil Search is not able or does not have the capacity to partner and to hold the hand of the health ministry, there have also been concerns not only with this one company, but that the government gets very comfortable, and that it then begins to not hold, but then to tilt, and then lean, and then push its weight on you. Do you worry about that as well?
Of course. I mean, this is an extremely difficult and delicate balance to draw. There's been substantive efforts and substantial money spent over time by the Australian government and other supporters to build the capacity within the Papua New Guinea government. And there has only been, unfortunately, patchy success. There obviously is the national government, which we deal with, and as I say, they control the strategies and we work under those. If you go out to the field, to the country, to the highlands of Papua New Guinea, one of the areas that we work, the provincial government was only set up 2.5 years ago. They don't have a public service. They don't have the arms and legs to deliver many of the services that are expected. Now, we could stand back and say, well, look, it's government's responsibility to deliver this, knowing full well that they have absolutely no capacity to deliver those programs and save lives. And so our focus initially was to step in to become a deliverer of services through our Health Foundation. But now that's moving much more into working very closely with the provincial governments and helping them build capacity and helping them to progressively build their position. And this is not an easy or a quick fix. One of the local hospitals that we deal with, I call it a hospital, it's the nearest hospital to our main gas field that's on production, is deeply, deeply challenged. There is one doctor for 400,000 people effectively. There are massive health issues which we believe we must help the provincial government address. Now that is happening. It's happening with support of the national government, but it also takes some time to actually have an impact on people on the ground. And we've taken a view that we can't just step back and take a principled view, they're going to lean on us. They are going to lean on us initially, but let me tell you that the art is very much get that capacity in and progressively pull back. We have to do it that way, but our initial approach at the moment in this phase of activity is we want to stop people dying.
Yeah. Christoph, obviously Oil Search, Chevron have been able to empower and to support that capacity building.
Yep.
And before we get on talking about scale-ups, can you innovate people to want to build their own capacities from within themselves? What if there is a government where the workforce doesn't necessarily, as a collective force, want to do that much?
I think it is indeed a learning process. And coming back just to this Coca-Cola example, it was also first that the government people thought Coca-Cola would do it for them. Maybe sometimes they think you're doing it for them. And that's not the idea at all. I think the idea of public-private partnership and the innovation that the private sector can bring is to kind of build that capacity.
Absolutely.
And to transfer the innovation and to transfer that capacity. Yep. But that's a kind of mind shift that you need to achieve first. But once that happened, they say, oh, we are going to do that, but we will benefit from what this big multinational company is doing. that helped then to kind of initiate that. And I think that's where we have to aim for. It's not that Chevron or Allsearch or any of the other companies will do it, will run it. It's a kind of support function to make it sustainable. And I think the innovation transfer is maybe the key, benefit that the private sector can bring to many of these programs.
Let's talk about scale up, but also let's talk about types of services that you can help deliver. 2 years ago when we were in Washington, when there was the first, I think, PPP session within the framework of the International AIDS Conference, Elton John was there, and he's a bit of a private sector unto himself. And he uses that beauty of music and gift to unite people. And he told me that he was very, very much mindful today that what the Elton John AIDS Foundation provided 20 plus years ago, I think it started around 1990, 91, is very different to what it does today. So at that time, it was really about providing the best care possible for people who were clearly going to die. And they were able to prepare their partners and provide them with support in writing their wills, getting food to them, making sure that they could sort out their own logistics in their own lives. And for many individuals, very sadly, that was a very short period of time. Today, of course, it's very, very different. They moved over to Africa, and also they're now moving beyond Africa. The services are different. We're not talking about patients these days. We're talking about people who can live with HIV. What about for Chevron? How have you seen the types of services you deliver perhaps adjust to the according realities? And how have you been able to take that vision and blow it up to make it much bigger, to make it much more inclusive?
Well, it's all of the above.
Yeah.
So what I mean by that is we look at participating in the fight for the elimination of HIV/AIDS as kind of a global agenda for us. I mean, it's a theme for us under health because of where we operate and the needs. So we will do everything from providing hot soup, in communities outside of Cape Town to nourish an HIV kind of community, right up to, big partnerships to scale up mother-to-child, preventing mother-child transmission of HIV. So it comes in all shapes and sizes to distributing, free condoms and education at our service stations in the Philippines. So it can look like a lot of things. So what you bring is a lot dependent on what the local need is and the communities you decide to support. But what underpins kind of all of that is that the partnership, you have common goals that, and it's been mentioned here, in geographies that make sense. So for a business, I mean, this issue is in a lot of places that we don't operate, but we only support where we operate, and that keeps us connected to our communities. It has to be connected to the national agenda. Government cannot be on the outside. Peter made that point, Christoph made that point. So important. And it is about, what I like to say, building capacity versus building bricks. I mean, it is, and that's a big shift in corporate responsibility focus for a lot of companies, and it's right. You have to offer tools, expertise that allow the governments to perform and to help them get there quicker and more efficiently. I mean, maybe governments are motivated and don't know how, but business can help them. And what we bring is, business-driven thinking. We use data. Data is a big thing. We solve problems, and we seek results. And so in any partnership we go into, we would say, what problem are you trying to solve, like Christoph said? What can we bring to it? We look at the scalability, and what are you going to measure at the end of the day? And I think that gives what we bring is a business mindset to a social problem, into a public sector. And that we've seen that adding value. And we start small. Let's try this in 1 or 2 communities. And if it works, we can, and then the government then is supportive. I mean, what we don't need is an innovative public sector. We need a committed public sector. And with that, we can then help with the scale up. So that's kind of how, it's a lot of things. Scale up works once it's proven, just like the Coke distribution model. Once it's proven, business knows how to scale up.
I want to quickly, before it disappears on the screen, that beautiful series of images that Chevron produced. I think there were 8 images that were created a year and a half ago, which you continue to use today, with that beautiful measure AIDS is going to lose. And I love that because it really bridges some of the women and girls who are very, very much affected to this day by this epidemic. I am very, very conscious that we're in our last minute, so if anybody's standing with a clock somewhere but I can't see them, we will get to you. I'm also equally conscious that somebody in this audience may have a question. We can take a question. If you do want to ask one, we'll take it right after this. And if you do have one, just raise your hand and I'll see you there. We have someone already, but while the gentleman makes his way up there, Peter and Christoph, very quickly, let's talk about the how-tos. As we said, there may be people right here in this room right now who says, I want to be a part of this, I want to talk to somebody who can make that happen, to be a private sector leader, private sector company. The title of our panel is Leveraging Complementary Strength for Impact at Scale. What are the key ingredients to move from an HIV pilot project, like Rhonda said, in 1 or 2 communities? How do you take that big if it needs to be? And is that an achievable goal, even where HIV prevalence in countries like PNG is especially high?
Well, I think first off, the dialogue that we're having here is a significant step forward in terms of bringing people along and showing examples and real examples that have worked both from a social and a business perspective. There is no doubt that dialogue is passing a message, presenting positive examples of how we can actually scale up the PPPs in very specific examples and specific environments. It certainly is something that we feel and have found in this conference, an ability to learn from other people's experiences as well as presenting our own gives us some empowerment to take back into our working environment and actually go and talk and lead with other community and private sector groups to drive a much better outcome and demonstrate this can be done not just in PNG but elsewhere. This is the direction that we have to go. And I might also say we need to demonstrate that to government. There's a huge ongoing suspicion about the private sector being involved in this. And I genuinely believe we need to demonstrate again through these sorts of forums what we're about, why we do it, how we do it, and how we can contribute in a very positive way, because there is a massive stigma about working with the private sector, which hopefully is being progressively overcome with these sorts of dialogues and examples.
I find that so hard to understand, though. Let's quickly connect with the audience. If we could ask for your name and where you're from. I think you're from South Africa, aren't you?
Right.
And your question, very simply.
Indeed. My name is Brian Brink. I'm from South Africa.
Yeah.
I work for a mining company, Anglo American. And I just wanted to draw to everybody's attention something which I think is truly remarkable and which is unusual. Here we have 2 of the senior leadership executives whose business is oil, something that we depend on in our daily lives. And they're sitting in front of you, James, and they're talking with consummate ease about health, talking about these epidemics, HIV, TB, malaria, talking about health system strengthening, talking about bringing to scale, talking about working with government, talking about working with NGOs, knowing all about these health issues and showing willingness to be involved and actually making huge contributions. I know the contributions that these companies have made, and it's unusual and extraordinary. And I simply first want to say thank you to both of you for doing this. And I think all of us here should show a great deal. And then I just want to ask one other question. In our daily lives, we come across so many other products which all come from the private sector. And where are all those other executives of all those other big companies? If we could get them all involved, it wouldn't be long before we beat HIV and TB and malaria. So I hope there are going to be many more that follow your example. Thank you.
I think that wasn't so much a question, but much more a very, very courageous call to action over there. Before we wrap up over here, I know that there are other examples, but they are few and far between, as Brian said. There's Standard Chartered Bank, for example, which has done marvelous things, and they have individuals within them, people like Lin Kok, who can really move mountains. And I remember when I was in China, when I first moved there for work to Beijing, she'd be sitting in a whole room full of CSR people from the other companies, which I'll tell you about later. But she'll be sitting there, and she'll be the only non-CSR person. And at that time, she was the head of the Beijing office. Now she's the country head of Thailand. And it was so critical for someone to be there who can really make things happen at the central level of a company, like you need that also in government. And that they create these very sustainable solutions. So over there, one idea that they've done for PPP is that everybody who comes in is employed as part of their HR induction course. They're taken through the whole course of HIV awareness, and then they are allowed to become HIV champions after that, which means they go further training and they become champions within their own office. And of course, they have the marathon that's very, very influential across Asia in raising funds as well. As we wrap up today in our very special time together, I'd like to ask all of you to provide us with one take-home message, and we'll start off with Peter there on the left. All of your firms have substantial experience and knowledge in addressing the HIV epidemic. What do you see as the future challenge and trends? One idea.
Well, I think the number one issue is to empower and explain to other companies and the private sector as a whole, this can be done and you can make a difference, and really translate that into a business imperative for them. Many people don't get it. Many people don't get it, and being able to demonstrate a compelling business model that drives a company in this direction and showing examples of that and communicating that across the private sector is the number one thing I've taken out of this to talk to my colleagues and get them involved.
If we get the private sector involved with all the strengths that the private sector has, the financial resources, but far beyond the financial resources, the business acumen, the innovation, the efficiency in helping with program implementation, if we can do that on a much, much broader base, as Brian just challenged, so many other companies, then we will accelerate so much, the kind of ending this epidemic. We've made great strides already, but I think we have a great vision, and the private sector is absolutely an essential part of that and can help so much to accelerate that process.
Well, I think I'll leave you with kind of three thoughts that kind of summarize. Employees first. Look inside your companies and make sure you're taking care of them. That's the place to start. If you're in public-private partnerships, equal partners with government, and always you're jointly kind of accountable and responsible. Make sure you always have that equal commitment. And third, start a movement. I arrived here at 1 o'clock this morning because I had to take part in the San Francisco AIDS Walk, and we got over 800 employees and their families and their baby strollers and their puppy dogs walking to support SFAIDS yesterday. So get your whole workforce engaged, and that awareness will just multiply through the communities around the world.
I think you're over $25,000 so far in that fundraising
from the employees. Yeah.
Employees. Last World AIDS Day, we were here in Melbourne, and we asked Aung San Suu Kyi, who is that great figure of humanity, what would you do if you're looking for that crack of light in your own life, as you did for so many years when you were incarcerated in your own home? If someone has a problem in their own house, or they have a problem with their health, or even HIV and AIDS. And she said this, she said, you just step onto that road and you walk. It's as simple as that. The road is there in front of you, but you firstly have to be brave enough to take that step and to go onto it and to walk. And as you walk, you will find good companions along the way. And one day when you're not here and you've gone, there will be other people who continue that journey from where you left off. that's how we're going to leave off. I'm so happy that we could be here with all of you today and everyone in this room, Ron Zaigaki, Christoph Ben, Peter Botten, and everybody here. Thank you very much for joining us for this plenary, and have a great rest of the conference. Thank you.